In 2017, I had been an instructor already for CPR and health and wellness classes. And I started to experience some shortness of breath and some a cough that wouldn't quit. And I went to the doctor and they told me that it was bronchitis. I went for a round of treatment and the symptoms didn't go away. They actually got worse. I went back to the doctor. They told me it was still bronchitis. But then shortly after the new year in January, my blood pressure spiked. I was feeling exhausted all the time. And because I had attended conferences and spoke to a lot of survivors, and I had it in the back of my head about what could possibly the symptoms might be and what the results might be. I took myself to the cardiologist, went for a series of tests. They gave me a stress test, which I failed dramatically within the first 3 minutes. That sent me for a round of more tests when they told me I needed to have some stents put in. That surprised me, caught me off guard, but I went to the doctors. I went to the hospital for the procedure. And as I was having it done, the doctor told me he could not do it. I ended up having 4 arteries that were blocked. One was 40%, 2 were 70%, and 1 was 100%. So they said I needed a bypass. Turned out I ended up with a triple bypass because the 40% artery had started to regenerate itself already. I was in ICU for 8 days because I had some breathing issues. But then when I recovered well because I had been in fairly good health to start with, aside from not knowing I had heart disease. Went for the rehab process, the outpatient rehab process, and decided that I was definitely going to continue teaching CPR and BLS classes because now I had a story to tell. And I wanted to make sure that I got the message out to everybody that symptoms in women are much different than they are in men. A lot of them overlap, but women experience symptoms that men don't. Some of them being flu-like symptoms, cough that's consistent and doesn't quit, always feeling exhausted, some back pain. I didn't experience all of those. I had a few, but then the typical signs in men are the crushing chest pain, the sudden onset of nausea, the sudden onset of excessive sweating. These are all signs to look out for, as well as your family history. I did have heart disease in my family, but I just attributed it to elder people in my family. And I knew I had high cholesterol and everybody in my family did as well, but I thought I had that under control, which turned out I didn't. So my is to eat well and get out and exercise, which is what the whole point of this heart walk is, to get everybody in the mindset that even if you're only walking a half an hour or an hour a day, it's definitely going to help your health. And you want to make sure that you know your numbers, know your cholesterol numbers, know your blood pressure. And, you can keep track of that stuff at home. Your cholesterol number should be under 200. Your blood pressure the target should be about 120/80. Your resting heart rate should be between 60 and 100 beats per minute. A lot of people have watches and gadgets on their phone that can keep track of this stuff. Very easy to do, just to make yourself more aware of what's going on in your own health. And the most important thing is to be an advocate for yourself. So when the doctor tells you something, if you think otherwise or you're not really sure, pursue it. Go to another doctor, ask questions, and stay on top of it. It's very important. But get out there and walk and get everybody to walk with you for this heart walk. It's important.